My name is Boniface, Mouti. I'm the Country Manager for Southern Kenya.
My name is Delfina Reuben. I'm the Head of Education Program in Kenya in Tanzania. Southern International. They combined their efforts with governments in East Africa, to talk to the beneficiaries in the communities, but also those in the health care, to see how they can support with the prevention and also sensitization and awareness. So in collaboration with the governments, in Kenya and Tanzania, we were both able to reach the beneficiaries in the geographical areas where we are working, where with the technical support of the health officers, but also with the financial support of Southern International, we were able to sensitize and create awareness to the community members about the COVID-19, how it is spread, the prevention, and also how to access the health services. The governments across East Africa, they set up the hotline for the continued support for cases, and also the health ministries are both in the national, district, and regional level. They created a triage system where they taught and gave the skills and resources for health cares, like in the dispensaries, on how to identify people with the COVID-19 and how to care for them. So it involved both from the community level to the highest level.
To create awareness among our communities, we went out with public address systems, sensitizing the communities about COVID-19 and the challenges that come with it, and what was required of the communities, to do and protect themselves from the scourge. We produced pamphlets with information about COVID-19 and what was required, that moment of creating awareness and sensitization for people to protect themselves. That we were able to do with the support of the government through the Ministry of Education, through the Ministry of Health, and we worked closely with government officials to pass across this message to all communities that we work with in our areas of programming. The second thing that we were able to do was to produce masks and distribute the same to our target communities, because we realized our communities come from extremely very poor background, and some of them would not have afforded, to get the masks because it seemed very expensive. Therefore, we felt we had a responsibility, to produce and distribute masks to these vulnerable communities. We managed to do around 6,000 masks, for the people in the communities. Because schools had closed and children were at home, very idle, doing absolutely nothing. So we focused on our target students, those that we support their schools, and we came up with what we call home learning packs. So the home learning packs actually is a package of learning materials that we were able, using our teachers and social workers, to distribute to children within their families without calling them to groups, and the teachers would pass by in every family, marking the assignments and making recommendations to the students. And in that way, we were able to constructively, engage the students, rather than them, being idle and being mischievous in the community and wasting a lot of time. We were able to distribute around 120 washing points to various people, to various villages in the communities, and together with soap, so that people could continually wash their hands as a way of trying to manage the crisis. We realized the families, were going through a lot of financial and economic constraints because most people had lost their jobs, and therefore it was even very difficult for them to feed their families. So we came up with a list of vulnerable families, and we were able to distribute, food hampers to these families so that their children would not go hungry. But again, on top of that, as part of, emotionally supporting them, we came up with a psychosocial support program to be able, to emotionally accompany the families and encourage them, as a way of going through this crisis.
We also collaborated with other partners like Aware, who are the US-based organization working in developing countries to improve the access of clean and safe water. So we contacted them, and they have given us access and the use of their mobile app called the Well Beyond Wash. Through this app, we have been able to reach and support ourselves as the Story team to learn about the COVID-19, the prevention, and how to continue to be safe. But also, we have shared the app with ward education officers, the government officers. So the plan is that by the end of October, we are expecting that all the program schools that they would have used the app, to continue to create awareness to the children and the teachers and the communities.
The fact remains that COVID-19 is here to stay with us, and the earlier we design programs that are meant to manage it, and try to contain it, the better. So going forward as an organization, we are trying to re-strategize and ensuring that we have mainstreamed, activities within our programs and projects that are aimed at combating this crisis. For example, education is very critical to us as an organization, and therefore going forward, we intend to work closely with the schools, and the Ministry of Education by ensuring that, we are able to comply with the Ministry of Health alongside the World Health Organization requirements by making sure that schools comply with the protocols that require social distance, that require washing hands all the time, and also maintaining high standards of hygiene, because that is the only way we can be able to combat this crisis.